We are privileged to have with us Dr. Mantasha Binti Rashid. She's a civil service officer from J&K cadre. Since 2011, she has joined civil service and presently she is posted in Srinagar Development Authority as secretary. And she will be talking on domestic abuse is a health concern. To introduce our first speaker, Dr. Mantasha Binti Rashid is a state service JKAS officer from 2011 batch who is currently serving as secretary in SDA, as I informed earlier. She has had her master's degree in social work and another master's on Fulbright fellowship in gender and policy from the State University of New York. She was awarded PhD by the University of Westminster, London on her thesis titled Violence Against Women in Kashmir, Intersection of Personal and Political. She is a founder of an advocacy group called Kashmir Women's Collective. We have been seeing their activities over last many years, and that works on gender rights, violence prevention, and provides support to women survivors of gender-based violence. Dr. Rashid is an ardent advocate of women's rights as human rights and an initiator of multiple community-based projects in Kashmir. I, on behalf of the Department of Community Medicine, welcome you and thank you for coming to us. So I would like to invite Dr. Mantasha Binti Rashid for her presentation.
Good afternoon, everyone. Adab, Assalamu alaikum. I'm Dr. Mantasha, and I'm very happy to be here because, coming from Kashmir, our generation, when we were growing up, our parents dreamt that we would go to medical college or engineering college. Engineering came second always in their minds. So I'm glad to be here, and I'm very happy that Dr. Salim, who is your HOD, under his leadership, this department is doing very well, and I've seen this department perform during COVID pandemic and offer its services, and I'm so glad that all of you, whether faculty or students, I'm not very well aware at the moment, but whoever you are in the audiences, I'm so glad to be here today afternoon to be discussing a very important topic which is close to my heart. Because I am somebody who, while growing up, always believed in women's rights and women's, issues. And I always wanted to sort of have more space for women in all the boardrooms, in all the decision-making capacities, in all the spheres of life, in all the professions. So while growing up, I didn't know that they have a term like feminist for such a person. But then later, I realized that this term is so abused and so misunderstood. Well, let's not go into that. I'll stick to my topic of domestic abuse as a public health concern. For this talk, I'll try to keep it brief because this topic is close to my heart, and when I start, it's hard to stop me. When we talk about violence against women, it's a very broad term. And you as doctors would know that how United Nations have gone to expand the term and sort of delink it specifically from physical violence. They have expanded the term to include mental violence, economic violence, social violence. Now one wonders what a term like economic violence means. What does it mean? What does it signify? I wonder how many of us here have their mothers, aunts, or elder women at home who have received share of their ancestral property. I won't be surprised if it's one or two hands. Because I did a survey during my PhD that do women actually receive the share from their parental property? Not equal as per the Constitution of India, but let's say whatever is prescribed in the Holy Book of Quran for Muslims. I was surprised. From among a random sample of 100 women, I was surprised to see that only 3 women have received the due share. And when I went on to discuss with them if it was actually as proportionated by Quran, they were like, "Na thoda kam zyada huyat as nibov." This is a case of economic violence. In Kashmir Women's Collective, which is an advocacy group of women who help victim survivors of violence, we provide legal services, psychological counseling, and other kind of support to, victim survivors of violence. I saw a lady in SUV driving to our office and seeking help and crying. On a roadside, you would be like, wow, what a woman, a role model, we would want to follow her. We would want to, own a big car. We would want to be, standing on a stage and talking. But her condition was known to me and some other people there. And obviously, because these details are confidential, I cannot name the person. She is placed very well, but then socially disempowered. Who disempowers women? It's a different topic altogether, because there are reasons and there are causations. Not going into that, just wanted to say that domestic violence is real. If we understand what domestic violence is, what domestic abuse is, it is of psychological, physiological, mental, economic, social, of all kinds, in all spheres of life. That is why gender as a prism is very important, whether you're studying medicine, engineering, or even social sciences. There are, different sets of data, but I'm a qualitative researcher. I don't believe strictly in data, because I believe that you'll always find data and statistics in support of your argument. And statistics particularly hide more than they reveal. I don't know if you agree, especially quantitative researchers may not agree with me. But that debate for some other day. So mostly you will see that 1 in 3 women across the world, globally, have suffered some kind of violence at some point in their life. And we don't need to go by data. There are so many women here. Can any particular woman tell me that she has not suffered discrimination, abuse, violence, or hasn't been dismissed for being a woman? When we travel in public buses, at least I used to go to school and travel in a public bus, we used to be groped, touched. When we do our PhDs and higher studies, our supervisors have certain kind of demands from us. And even if they don't, fortunately, people think that some woman is going up because she's a woman. We are not seen as equal and capable human beings. Our gender identities very often used to put us down. And putting down may vary from women to women. Some of us are privileged. We belong to urban circles. We may have a caste privilege, a class privilege, or other kinds of privileges, which are very important to acknowledge. But other less fortunate women suffer, and sometimes even the most fortunate ones suffer, right? I don't know what all is coming in your mind as I'm talking about this. I'm sure you're recounting the number of incidents or experiences. But for the amazing men folk in the room, obviously they don't have such experiences, but they have been a part of such experiences, either unfortunately in creating them, knowingly or unknowingly, in perpetuating them, in exacerbating them, in supporting them, or simply being a silent player in them. I talked about globally 1 in 3, but how about the local scenario? Our local scenario is also not very great. Unless and until a patient comes to you and says, you'll not be able to treat that person till the symptoms are revealed. Till our society stays quiet about violence against women, till we brush it under carpet, till we deny it, how can we really address it? The first thing is disclosure, right? The first thing is standing up and saying, this has happened to me. I want you to hear this. Because there are so many of us who are silent and may not have enough courage to talk about it. If you look at the National Family Health Survey report of various years, you will see that more than 50% women justify being beaten up. They think it's normal. They think it's normal, and our grandmothers, our mothers, our neighbors, our societies tell us, we don't have examples of healthy, we may, but we have a very few examples of healthy, respectful, and equitable marriages. Mostly we say, so if a woman doesn't want to live with her in-laws, she's told that, she's a disrespectful woman. It is believed that we probably don't want to take care of our partner's parents, and therefore we don't respect elderly people. I wonder how many men would be in that position wanting to take care of the parents of their wives. If we claim that we are a Muslim society, we follow Islam, you would look at Islamic countries where two people get married and then they move into a new place. They have to adjust one to one. Man adjusts to woman, woman adjusts to man. Makes it simpler for a new life. Whereas a woman has to go to her in-laws and adjust to 10 people. And rather than being given benefit of doubt that she's a new person, she's come from a different set of beliefs or ideas, it is expected that she will make the adjustments. I'm connecting the global scenario to actual local practices which perpetrate violence. We may not see the linkages clearly, but linkages are there, right? The question arises that do we really as a society care about elderly people and parents, or do we just care about parents of male children? How about those parents who have only girls? Don't they take care of themselves? Don't they manage with their daughters living around? The privilege is that of the male gender, and the privilege is of the parents who give birth to male child. And the expectation is that someone else's daughter will come and serve them. I mean, it's great. You're a good human being if you're able to serve them. You are kind-hearted. It is commendable. I am not for even a single moment saying that you shouldn't do it. But if you're unable to do it, if you're unable to deliver, you shouldn't be put to violence. And you will see in the data, it says that women say it's justified if they are beaten up for disrespecting the in-laws, arguing with the partner, not taking care of children and household responsibilities, or for being unfaithful in the relationship. I would say violence in no situation is acceptable. Even it is for being unfaithful, even if it is for doing anything evil, it has its proper way of being dealt with. But justifying violence against women, which we often do by conflating culture with religion. I don't know how many of us are Muslims, but assuming that predominantly we are a Muslim audience, don't we often say that it's okay to beat women because wrongly interpreted, the last prophet of Islam used to at least say, chalo miswak se maro. But what does that mean really, miswak se maro? If someone is a diabetic and he's not keeping a control on his diet or her diet, we would say, chalo thoda kya magar control kar, which means we are actually saying it's not allowed. Please restrict it to the point of bringing it down to no, right? In a society 1400 years ago where women were not equal, they were treated as properties, as animals. If the Prophet of Islam, Sallallahu Alaihi Wasallam, says that, miswak se maro, which means please restrict it. Don't do it. I'm not a religious scholar, so I'm not going to go much deeper into interpretations. But whatever little I understand, as a scholar of social sciences, I would never say that my beloved Prophet would say that it's okay to beat women. No, never. Right? So certain practices in religion, conflated with culture, are used to justify violence. Another very common thing is more than one marriage, polygamy. In Women's Collective as advocacy group, so I do my public service, which is my livelihood, paycheck. But after that, I follow my passion. I'm available there for women. I've accompanied them to police stations. I've arranged counselors for them. In many cases, I saw men say, "Adhas mehas kor bya khandar me os nawar emisit. Chalo when thik karo til karems divorce ems di kya khai emis, right? Rightfully. The nehas batavan ethi. Whichun emisit war. Ethi kya is thawan. Nehas me hak diwa Islam, behek zakarit, behek trakarit, behek tzor karit, right? Misinterpreting religion for justifying our petty desires and ideas. We all do it. We all are guilty of it. I mean, women also do it, but I'm here to talk about, in a particular context and framework. So how does this violence, how do these local customs actually become violence against women? And how does this violence against women become a pandemic? How does this become a global health concern? It becomes a global health concern by sheer numbers. You would see that, I think it's 200. I'm missing a stat here. Yes, here. यहाँ पे actually थोड़ा dark है. In the US, intimate partner violence results in 2 million injuries each year, making it a larger health problem, more than obesity and smoking, right? So intimate partner violence leads to long-term issues. IBS, chronic pain, heart disease, stroke, sleeping issues. And such cases, such women are at high risk for suicide and likely to suffer from depression, anxiety, panic attacks, PTSD, etc. And very often, more than often, they are comfortable in going to a doctor because of their physical issues. They may not be as comfortable contacting a support service or going to police or going to a lawyer's office, possibly because we don't have systems in place. Another possibility is that even if we have systems in place, they're not sensitive enough. But the reality is that doctor is often the first point of contact for such, survivors of abuse or violence. And doctors miss it because they are medically designed. They are medically trained. पेट में दर्द है, पेट की गोली दो. सिर में दर्द है, सिर की गोली दो. And possibly it is not in their power to investigate into further causes of the illness or the symptoms, but possibly professional curiosity and empathic, compassionate nature can lead to that, to go beyond the symptoms. And it's not me just advocating for that. There is a proper system called IRIS in UK. It is basically identification and referral to improve safety for women. And it has become an integral part of NHS in the UK. So there are people from support services placed in the hospital. Doctors have to refer any cases who they think could be of potential domestic abuse, violence, or discrimination. And then obviously support services take over, because doctors don't have expertise in this field. But at least they can act with compassion, right? They can act with empathy. If I borrow some slides from IRIS, they say when a person comes with you, when a woman comes with you with certain symptoms, which you think or suspect could be because of domestic abuse, ask these questions. How are things at home? Does your partner stop you from doing things that you would like to do? Do you feel criticized and put down by those close to you? Are there things that happen at home that scare you? Are you afraid of someone at home? Sometimes women who have these symptoms, injuries, have been frightened or hurt by someone at home. You can ask them, has anyone's behavior hurt you? I don't know how much of this can be used here. I mean, it belongs to a different system, altogether. But certainly, things we can borrow, we must borrow, without any shame or hindrance. This says, don't ask the woman unless she's alone. And if she has a child over 2 with her, it's not safe to ask. Child might go back and, repeat these questions at home. During COVID pandemic, you would have read in international dailies or seen in TV debates that the numbers of calls for help to helplines across the world increased dramatically. Because women who were living with their perpetrators, obviously the risk was enhanced because the number of hours together increased, and then the access to the support services was minimized because of COVID in place, right? So this just becomes an example to see that home, which is celebrated as a safe haven for women, is not always so. This is another myth in our culture. So as an anga asal yosna garna barnier kihin, kya kiche mahfuz asanga rasmans. It's a myth. Very often, more than often, domestic abuse, violence against women takes place within home. And there are stats which say that up to 30 to 40% of women who are killed, they are killed by their intimate partner. Which is the recent case this week. Shraddha Walker, Mumbai. So this man literally cut her into 35 pieces and dumped each piece a night across Mumbai. And interestingly, I was going through her case in details. She has reported to hospital GP in 2020. They have referred her case to Mahila Mandal. It's very easy to say that, why don't you leave your abusive marriage if it's violent? There are constraints. Women face constraints, social, economic, psychological, and we have to be sensitive to them. How do you respond as a doctor to these questions? Validating is very important for someone who has suffered abuse and violence. Because when we dismiss their feelings, when we dismiss their experiences, we basically prevent them from confiding in someone else. They start doubting themselves. They think, "Main chuba aasan, shayad sarni hi zindagi se aasan. I am exaggerating my conditions." So it's job khawan. Thapir karin normal in a marriage, right? So saying things like, "I believe you, this is not your fault, your safety at home and that of your children is a priority, support is available for you, I know someone you can talk to who will see you here in the practice and safety, thank you for telling me." These things and ideas around these help. And unfortunately for health, it's not criminal justice system that perpetrator doesn't matter to you. Perpetrator is also a patient. They might have psychological issues. They might have depression, anxiety, psychosis. And you also have a responsibility to recognize that. Basically, I'm talking about these things and putting them on your individual shoulders in absence of a system to do this. Like IRIS is not there in place in J&K, in India for that matter. Therefore, it falls on your shoulders. But once a place is, a plan is there, a scheme is there, a system is there, it becomes a systemic responsibility. Again, how do we talk to perpetrators? How are things in your relationship and at home? Do you feel out of control? We're not going to ask him, "Do you beat your wife?" He'll probably beat us in return, right? He'll get violent. So we ask them, does your family, do your children feel scared of you? We don't say that you are scary, right? Does your behavior make your children sad? Does it make you sad sometimes? Do you regret hitting your wife or doing something like that? Are you worried, stressed, angry? Is there conflict or tension in your relationship? I mean, they are just, tip of the iceberg. Again, helpful responses for perpetrators. "I'm glad you told me. We can help you. Support is available. Violence and abuse is never okay. This will be affecting your children. Abuse is not the answer." I want to talk about certain things which are there in countries like India. So Nepal was basically one of the pioneering developing countries which adopted a system called OSC, One Stop Center. I'm sure you would also have come across this because now it's in place in J&K and other states of India. I mean, it is in infancy. There is a lot to be done, but at least there is a helpline number, 181, on which you can refer your patients. You can see someone suffering in the neighborhood. You can see someone in the bus. You can strike a conversation with somebody on the roadside and see that they are in need of help, and you can refer them to 181. What does 181 do? Provide lawyers, free lawyers. Provide counselors, free counselors. There are paralegal volunteers from District Legal Service Authority, DLSA. Maybe if it interests you as an area of research or hobby, you can look it up and see how there are certain systems of support, if not ideal, if not perfect, but at least there is some rudimentary existence of systems out there to help women. There are police stations. I think Sleeth can talk about that in detail. And even if you don't go to a women's police station, you can register a 0 FIR. I'll leave this for her. She'll address it. And there are laws and litigations. There are acts. There is Dowry Prohibition Act. There is PCPNDT. There is Domestic Violence Act. There is POSH, Prevention of Sexual Harassment at Workplace. There is POXO, Prevention of Child Sexual Abuse. And I don't know what this MM is. I think it's probably a typo. So there are litigations. There are acts which are in place. Probably enforcement is not as strong. We have our own issues in terms of human resource, which is limited, which is not sensitized enough. But as a society, I'm sure if we get sensitive to these things, if we begin to accept it, if we don't brush aside these issues, if we talk about them, if we support each other, and if we don't internalize patriarchy, sometimes we don't need anyone else to put us down. We are there. Women are there to put each other down. Because we have internalized so much patriarchy. We judge each other and our own selves by the same lens which is made by the society. Sometimes as working women, our house may not be as clean and we blame ourselves. We're not good women. We're not able to balance between taking care of children and then doing our job. At job, we feel that we're not good workers, we're not able to give 100%. Our children are at home. And then when we are home, we think that, we're not being good employees, we're not being good mothers. So, like they say, a woman cannot have it all. So the systems are made such that there is a natural doubt in a woman. And they internalize a lot of patriarchal ideas and concepts, right? Just looking at if I left out anything which I wanted to talk about. Yes, I also want to say that domestic abuse or violence does not start after marriage. It starts with the birth of a girl. Unfortunately, when the male child is given a bigger piece of chicken, an egg in food, and we are told, do you know where it comes from? If you interrogate these norms and customs and beliefs, you will understand where it comes from. बच्चा कुछ अभी तो किसी को खाना है ना यार, आदत कर दो ना अभी से लड़की को, कल तो ससुराल में भी ऐसा ही होगा. So कहीं ना कहीं, since we are born, we are fed on these norms. And then tomorrow, if we are not able to leave an abusive relation, why blame ourselves? There are decades of messaging which has gone into our heads, right? Also, as doctors, I've seen doctors are not comfortable in taking medico-legal cases. They say it's difficult. It involves a lot of work from our side. They hesitate. But medico-legal cases are the cases of the society. They are the cases of morality, where our ethics tell us that, we have to stand up for them. I remember I brought in a survivor of rape to LD, and the doctor denied touching her. Because she was in trauma, she wasn't letting the doctor touch her. And doctor was like, yes, I cannot help it. She's not letting me touch. I said, she's a rape survivor. How do you expect her to, let you touch her? And she wasn't mentally too fit. And then she said, oh, it's a medico-legal case. Now I cannot touch her at all. You bring in whoever you have to bring in and then we'll see. So just being sensitive to these things in your profession, I'm sure it will go a long way.
So please, in no way I'm disrespecting a woman. I personally have huge respect for a woman. A woman, our mother is a woman, a sister. So, okay. So, but ma'am.
This disclaimer entertained.
Okay, ma'am. So the thing is that I want to point out is the way, meaning no disrespect to you, ma'am.
Okay.
The way I felt you put it was that you are. What is happening is among the audience many of us must have realized this. We are victimizing one part of the society and we are accusing the other part of the society. So it was like, in clear words, I will say, men must have felt कि नहीं ये direct attack है हम पे. Okay. So what I feel, ma'am, it should not be like this that you will victimize. नहीं ऐसा है नहीं. It's not. अगर if we start talking about it, ये एक discussion बन सकता है which could lead to a socially थोड़ा सा ये भी हो सकता है. Exactly, मैम. So मैम मुझे लगता है कि it should be in a way कि जिसमें हम एक को victimize नहीं करें और दूसरे को accuse ना करें, because at some point सिर्फ females are not जो victims होते हैं. For example, when ma'am was mentioning her examples, she was, if you have noticed, her examples में victim was a male and a scammer was a female. So that is also kind of a economical violence, if I must call it.
We could also be scammers, we could also be victims.
Exactly, ma'am. So exactly, ma'am. So ma'am, and other thing that we can't deny is in the society we live in, हम culture deny नहीं कर सकते हैं, ma'am. क्योंकि मैम मुझे लगता है it starts, अगर एक basic सी example लेंगे, it starts when two families meet, एक relationship बनता है. So जो ये menace है हमारी society में, which starts from the engagement till wedding, मैम. So मुझे लगता है ये सबसे बड़ा menace है. And इसमें हमेशा अब लड़के की family is not responsible. So how would you respond to it, ma'am?
Couple of things you brought to notice. One, my theme was gender-based violence. Violence against women is a health concern, right? So it was a specific theme. It was not gender neutral in the first place. Second, it's not me saying it, United Nations, other international bodies, health departments across countries. I gave you examples from the US, UK. It is an admitted fact. There is enough data to say that both genders, all genders, because in today's society we don't say that there are just two genders, there are multiple genders. All genders have been victimized. They can be victims of violence, survivors of violence, but disproportionately it is women who suffer from violence across the world, and it's a fact. A fact is a fact, and it's okay to admit it. Let me finish, because I let you finish, right? So the point is that taking it personally or thinking of it as an attack on oneself is something you must question. You were not involved. You're not someone who perpetrates violence against women, I would assume. Then why did you feel that it is towards you, or why did you think of manlyhood as a brotherhood which is under attack? If we are discussing a topic which is scientifically acknowledged, world, no, there's no need to clap. There's no need to clap. It's something. It is his observation. It is his observation, and he needs to sort of check his own privilege, because as a male there is something called male privilege, a gender privilege. For example, I'm a girl. When I wake up in the morning and I, let's say I'm a college girl, I look into the mirror and I have to dress up. So I'll be like, oh, this is too gaudy, it's little red, I might attract too much attention, therefore I'll not wear it, right? So I discard a set of clothes. Then I'll wear something very plain. I'll be like, oh, I look like 10 years older to my age, I don't look nice. Okay? This is one example in a day, dressing up. A man has no such worry. It starts from here. Now I'll pick up my satchel, I'll pick up my bag, and I'll go to my school. I have to walk to the bus stop. There are two options. I'll take a busy road, a congested road. I'll walk to the bus stop and I'll be like, बहुत लोग चलते हैं, comments करते हैं वही. I'll avoid it, right? So it's a point of discomfort. Then I'll take a deserted street. I'll be like, deserted है, कोई हाथ लगाएगा, कोई सामने आएगा. So both the options are equally problematic. A man wouldn't care. सुबह हो, शाम हो, कहीं से भी जाएगा. Why I'm saying this? I'm not saying it's a man versus woman matter. If you understood it like this, I'm sorry. Maybe there has been some miscommunication either in speaking or in hearing. I don't know which part is to be blamed. But the point is that there are certain things which come with gender. There are certain things which come with being a woman, which only a woman can understand. A man can be empathetic, and a man is a partner in all this. Partner in the sense of understanding and solidarity, showing solidarity, showing support, showing concern. And without engaging men, without actually using their solidarities, it's not possible to break the cycle of violence against women. And we need male partners who understand this, who are empathetic towards it. Rather than saying, oh, I feel attacked and I feel defensive, you have to say, oh, is this what happens to women? I never thought about it. I never go and ask my mother that, you wake up, you're the first one to wake up in the morning at 4, you're the last one to sleep at, let's say, 11. You may not be going out to earn money, but the amount of work you put in at home without any payment, without any paycheck, there is a stream of gender studies which calls it care work, the unpaid care work. So women are there to take care of patients. घर पे किसी का कोई elderly है, कोई बीमार है, बच्चा है, ये सारा disproportionately औरतें देखती है. And because it has no paycheck, we tend to devalue it. And because we devalue it, we devalue women. Because a person associated with a kind of job, we tend to see them like that. You see me as an officer because I am an officer, but other than that, I might have 10 things to do. But our job represents us. You see a housewife as a disempowered person who is not able to do much, who is devalued, who is a subhuman. You'll be talking about politics with your dad at home, and your mother will say something or your sister will say something, and you'll be like, why do we give weightage to our voices as men? And it's not about being attacked, it's about understanding, improving, acknowledging our privilege. At the beginning only I said even women have privilege. If I come from an urban locality, if I come from a particular class, particular caste, if I come from an educated background, I have a privilege over another woman who is from a rural background. Somebody who doesn't have a caste privilege. Somebody who is the first generation learner. I cannot say that all women are equal. That means creating a monolith of women, universalizing the experiences of womanhood, which is not correct. A woman in her experiences might be closer to a man from a particular class, compared to, being close to me in her experiences. I hope I answered your question to some extent.
Something that's connected. At least I did not. So I would compare it with something. Let's say COVID. You've said that globally 1 in 3 women have faced domestic violence, and COVID was such a pandemic, not of similar number maybe, but a number. And we saw the world shutting down to it. We saw everything was done to contain it. Flights were cancelled. The world just shut down to stop a health concern. And a health concern which is greater in number, much more. When will we start doing something so aggressively so that it stops?
That's a wonderful question, really. It was the General Secretary of United Nations, Kofi Annan, in 1999, who said that probably women's rights issues and the violation of women's rights is the most starkest, most pervasive, and the most shameful of human rights violations. Because half the population is women. That means half the population is being violated. And it's not just by men. It's not a men versus women game, as this gentleman understood. It is a systemic abuse that has absorbed violence against women as a norm, which includes women themselves. Women themselves are the biggest and highest carriers of patriarchy and patriarchal practices. Like I said, that women have internalized patriarchy. We judge each other. Oh, she's not looking good enough. Oh, she's not married enough yet. Oh, she's not, earning enough. She doesn't know how to manage things. She doesn't know this, she doesn't know that. We judge each other on certain parameters which are socially known, right? And you said that world shut down to pandemic, COVID, because it was taken seriously. World will possibly never take violence against women as seriously as it ought to. You pay for your sanitary pad, it is still taxed. Do we get periods by choice? It is a health concern. It's not something to be ashamed about. It's a part of reproductive health. Being doctors, I think it's the right platform to talk about it without shame. But even sanitary pads and tampons are taxed. Why should they be taxed? There are policy concerns in which issues concerning women. Do you know what the GDP of India spent on health is? Any guesses? How much percentage of? It's less than 2.5 this year. Yes, under 2. And in last 20 years, this is the lowest. 4-5 साल पहले 3.5 होता था. अब उसमें से imagine करो कितना for safety of women, for shelter homes, for women helplines, for training police to be sensitive to women concerning issues, for training first responders of women in hospitals. How much money is spent? Nil, negligible. When there is no policy framework. I told you about IRIS in the UK. I know it because I studied there. I volunteered in a rape crisis center in New York, and that's how I understood how seriously rape is taken. And now we have data and we read कि US में इतने rapes होते हैं, and we are like, अच्छे ज़्यादा rape गसां, अच्छे ज़्यादा खराबी गमच. They report it. The data is, much stronger, much more reliable. What we do is we deny. We don't have mechanisms to record data, scientifically record them, understand them, and hence we don't have means to address it. What I realized, the difference between developed world and the developing world is one stark difference, which I observed, was that the institutions are way stronger there. There are mechanisms to deal with problems. They are defined, they have a name. And sometimes this naming hurts us. This definition hurts us. We think, why are we calling it like this? Can we not talk about it? Why are we saying violence against women? Does it sort of put a man in, a jury's court? Why do we feel like that? So there's a difference of language, perception, understanding, institutional building. And unless and until there is institutional building and money is allocated to policy work for women, a prism of gender is adopted in health, in education, in social sectors, in scientific fields, be it research, be it policing, be it medical profession as such, nothing will change. I hope I answered.
Thank you very much. Introspective words to culminate this program. And before we move out of this hall, we have some felicitations for our guest speakers.
We will